What's the reason for having biomedical design? And I can say that for my part and the whole team at biomedical design's part, we have a dream. We have a dream to impact and improve healthcare through the needs-driven innovation methodology that we teach here at the program. And we do this, and we would like to achieve this through educational training of talented people like you listening here, so that you get empowered to become the future innovators for healthcare. This dream is not ours alone. The Novo Nordisk Foundation is sponsoring the program, and all the Danish regions are also backing us. And that's because they share the dream and see the same as we do, that biomedical design is relevant because for a number of different professionals, because we need to, in Denmark, to be better at turning academic research into innovation and innovative solutions in healthcare. We also need to raise the innovation activity among healthcare professionals in our health system. And we need to increase the number and the quality of the collaborations between industry and academia and healthcare to enable much more innovation for the transition and the transformation that our healthcare system needs to undergo in the next many years. And therefore, there is a demand for innovation competences, and there is a demand for employees and for entrepreneurs with an entrepreneurial mindset. So that's what we hope to achieve with this program. And so what could be the reasons for you to join the program? And I can say that could be to gain the competences and the expert network to innovate in and for healthcare. And then our program gives an opportunity to actually try out a full cycle of innovation on a real life problem in a safe space to fail. There is no demand from the program side that you should necessarily succeed all the way through in the program with the project you have or will develop. So the fellowship, it's a full-time education for 10 months for people who are already experienced professionals. And we have a monthly grant to cover living expenses. It's 40,000 Danish kroners. And each year we enroll 16 fellows. And the minimum sort of qualification criteria is a higher education degree and a number of years of work experience. Then I can say that we are looking for multidisciplinary backgrounds. So we are putting sort of the annual year group together based on trying to achieve as much interdisciplinarity as possible. And we also strive to get some gender balance in the group. And what do we look for? We look for people who have experience working in the health sector. That can be as health professionals, but it can also be other types of functions in the health sector. Then we look for whether you have some prior experience with a health innovation project. It does not necessarily have to be on some technology or with commercial scope. And we also look for if you have experience with innovation projects sort of in other settings. This could be in a research setting with some advanced applied research or in industry. And then also experiences from working in a startup or running a startup can be a qualification. And also other sorts of entrepreneurial experiences where you have tried to establish something of new value for others. So that's sort of to give you a sense of what are the qualifications we're looking for in the applications. As I said in the beginning, all the Danish regions that are managing the health system in Denmark, they are supporting our program. And then it's a partnership between Aarhus University and Copenhagen University. So these 16 fellows that we enroll every year are distributed between the Aarhus office and the Copenhagen office. And when you apply to the program, you can select whether you would like to be associated to one or the other cities. And you can also, there's also an option to say that other one is good for you. It's 2 offices, but it's one organization. We are a small team of 7 people managing the program. So it's a tight family you will meet here. For the upcoming year, the hospitals that we will collaborate with and where the participants will attend are the regional hospital of Viborg in Jutland, and it's also Aarhus University Hospital. And in both places, the specialty that our participants will do their field studies in is the cardiology. And the Copenhagen-based fellows, they will have their clinical immersion in the Hospital of North Zealand. And there the specialty is a mixed department. It's both cardiology and endocrinology. Yeah. So here's sort of an outline of our program, and where the first half is really focusing on learning you to identify and qualify needs for innovation. And that's where the field studies in the clinical setting comes into place. So after 2 weeks boot camp, you will go in and get started with your field studies in the clinic, where you will follow the clinical staff in their everyday work. And through that shadowing, you will identify you will simply have some wonderings about why they do what they do. And you will also see some things that, you will see things go wrong. And that is also an input for thinking, okay, how could this be done better? So that part of the clinical immersion is sort of from mid-September till mid-December. And then we begin sort of a creative skills phase where you will do some ideations and you'll rapidly test out the ideas. And gradually you will converge these ideas into concepts, and you will select one lead concept for one need. That will happen by the end of March approximately. And from there on, you will work on further deep development of the concept. You will do prototyping, and alongside with that, you will get a lot of lectures and strategy tasks on how to see the implementation of your project in terms of a commercial setting, all in terms of a non-commercial setting. So what are the strategies in terms of IP, regulatory, economy, development, and so forth that needs to be in place? So by the end of the program, what you have in your hand there is a final report that is sort of really converging all you have learned about an unmet need that you have identified and validated, and the solution that you have identified and validated that it is relevant to solve the problem. And then the strategy is sort of a first dig into what strategies should you have in order to succeed with implementing this solution in the real world. And you have a plan for how to continue the project onwards if you should desire so. Yeah. Throughout the whole process, you will be in a team of 4 people. And it will be a team that we have set from the beginning of the program. And that also means that in this program, there is also a lot of work in terms of learning to be in a team and learning to develop a good team collaboration. That will have its own ups and downs, and then the innovation process itself is also a roller coaster with the ups and setbacks and so forth. So really representing the life reality of doing innovation. Our goals with the program and for you is that we say we develop people and projects. So we have a lot of sort of learning goals on the individual level. It's to increase our participants' creative self-efficacy, their entrepreneurial mindset, to get them competent in the needs-driven innovation process, to learn them how to develop teams, and to work in an interdisciplinary context. And then on the project side, we use the innovation readiness level to steer you through and to manage an innovation process in terms of the constant development of the project. I would like to stress today here that the innovation we do in this program is technological solutions to unmet needs. That said, the methodology that you learn and most of the tools that you learn in the program, they are applicable to innovation that does not involve developing a technological solution. But the program here and the context we run it, we focus on innovation of technological solutions. Yes, and then there is a sort of a broad outcome space for the projects that you develop in the program. We have a criteria, and that is that you focus on unmet needs that are scalable, and that means that it's not only relevant to solve in one hospital or one little region, but that it is relevant across a nation like Denmark, or that it's scalable in an international context. You can choose to focus on projects that have a commercial potential, or you can choose to focus on projects that have a non-commercial potential. But I'll say here that sometimes whether it has a commercial or non-commercial potential will maybe only appear towards the end of the program. So it's not all clear all the way through whether it has falls in either category. And then there is, based on that, there is a number of outcomes that can be in order to, or ways where you can continue these projects afterwards. And it can be industry collaboration. You can take the project out in a startup, or you can embed it in a research setting and continue it as a research-based innovation project. It might be that it is fairly easy to put it directly into an implementation project in a hospital if you have that access. Or it could be that it's a public-private partnership type of project, which is the right sort of format for continuing the project afterwards. We have no demands or requirements that you do continue these projects afterwards. So we also see that projects are simply paused or discharged by the teams afterwards. And we have also seen that a project can be handed over to another team afterwards. So, yeah. Where do our alumni work? We have graduated 87 fellows to date. And some of them are running their own startups. And with success, they are raising funding and investors and so forth. We have no products on the market yet. We have there's an app store. That's the sort of the closest to the market we are yet with anything. But they're getting there. Then we have quite a lot of fellows who, after the program, get employed by medical device companies in Denmark, and also pharmaceutical company like Novo Nordisk. They take up various positions, mostly related to, where there is a connection to their formal background and experience. But we have many examples where it has been sort of the cutting edge to have this program in on their CV to get selected for the positions they have applied for. Then to the left, we have quite many fellows who also then take positions in the Danish healthcare and in academia, all in what we call the third sector. That's sort of the sector that try to bridge between public and private and stimulate growth and development through various programs and initiatives. And we also have some fellows working in municipalities with innovation. Yes, and to round off, I'll give you an overview of the application process. So we have a deadline on the 15th of March, midnight. So you have all the day of the 15th of March. It's really important that you look up the requirements on our homepage. There are a lot, so read them diligently and comply to them. Then on the 31st of March, 36 to 40 applicants will receive an invitation for an assessment workshop. We will run 2 of these assessment workshops. One will be on the 9th of April and the other on the 10th of April. It's an online workshop, and it runs in the afternoon, and right after, there will be some individual written assignments that you should hand in by 9 o'clock in the evening. Then we have a process of looking into all that information and data that we get from there. And we are also then planning for some very short individual online interviews, and they will be conducted on the dates 39th to the 30th of April, and on the 8th to the 9th of May. And then by the 15th of May, we will send out admission letters to the ones that we have selected. If there are some who at that time point decline the position that we have offered them, we have a waiting list and will send out admission letters to people on that list. I can say also here that the 9th of April and the 29th and 30th of April are for the applicants applying to the Copenhagen site. And the other date is for the ones applying for the Aarhus site. And the ones who don't care where it is will distribute them among these dates. Yes. So, very, very last slide. We select applicants based on whether we can feel the passion, whether we can see the potential for implementing the skills that we give you here in your time after or post program. And then we're looking for your people skills because the program is very, very collaborative. So you need to have some skills to be with other people and to co-create with them.